Hello, today we're here with Chairman of Renew out of Singapore, Mr. Manoj Bhargava. He's a wonderful gentleman here and has joined us today to talk about many endeavors he has, especially with regard to healthcare. Hello, how are you doing? Thank you for joining us, Mr. Bhargava.
Thank you.
As an interventional cardiologist, I am passionate about ECP therapy, but many people don't know about it. Will you tell us a little bit about it for our audience?
History is of what we call the Renew product, which is ECP, is that it was invented at Harvard, I think, 30, 40 years ago. And it was for obstruction in the arteries. And what happened is the FDA approved it, and then it went to Medicare, and the fellows at Medicare decided that, well, instead of just doing it for everybody in terms of a first procedure, because it's not invasive, it's very safe, they decided, well, those fellas that can't have surgery, they're so weak they can't have surgery, we're just going to push it over to them. And once that was decided at Medicare, the rest of the medical community just followed that. The studies have been done, found out that this weakest population, 5 years later, was doing better than the fellows that got stents.
So there's a tremendous amount of clinical data, and people are probably wondering, well, what is ECP? What does that stand for? External counterpulsation. So the mechanism of external counterpulsation is really what makes the difference, isn't it? Than simple massage therapy or simple therapy for deep venous thrombosis, sequential compression. This device is different because it is timed toward the cardiac cycle.
What I understand is that enhanced circulation is going to help you. I'm not a doctor, so that part I get, that if you water a plant, the chances are it'll do better than if you don't water one, in the same way as enhanced circulation, I assume. And so the rest of everything, in terms of the mechanisms and how things work, that is in the literature everywhere.
So isn't it fabulous that a great entrepreneur can understand this physiology to the point where it can be taken to the masses of people? I think worldwide people should be able to have this wonderful therapy that can improve their coronary circulation.
I've talked to some of the top guys in the world, in research. And the interesting thing is, there's one thing in common with all the top guys. They look at it, when I point out what it is, they're saying, of course, it's obvious. I met a guy who was one of the top guys in wellness. And so I said to him, let me understand wellness. So it's basically you tell people, eat less, exercise more, and don't smoke. Is that pretty much it? He looks at me for a second, he says, pretty much. So I said, now we have this first time we have a device that actually will do wellness. And he'd gone through it, and he said, you're right. And so the top guys, it takes them about 2 minutes to figure out that it's really obvious.
And peripheral vascular disease is a huge problem, especially in our population or in the Western world, with smoking being such a problem and causing peripheral vascular disease. Right. And now entering the East, probably, it's a problem worldwide. And right. So such a benefit to increase small vessel flow.
It's one of those things which is so basic that why would you not do it?
That's right.
It's non-invasive. I mean, we have data from 75, 80-year-olds for the last 25 years showing that it doesn't harm anyone. As a potential patient, I would say that if somebody says, would you like surgery or would you prefer something else, I'd say, wait a minute, isn't surgery supposed to be the last thing you do? To me, you've got pipes, right? If one pipe is clogged, you put a stent in. If one pipe is clogged, though, the chances are the rest of the pipes aren't doing so well.
That's correct.
Right? So wouldn't you want to do something that affects all of the pipes?
How do you think that we can educate the population worldwide about external counterpulsation?
The cardiologists are the gatekeepers right now because it is FDA approved it for angina. Once they start using it for angina, then they find out, oh my God, there's a lot of other things that are getting better, right? And then they're sort of trained to say, oh, I want to do this again.
And worldwide, Are you able to make a change in people's lives now with your device?
Actually, it's going to go much faster outside the United States because there's a lot of legacy here. In other words, we do this way, and that's how we're going to do it. Whereas in other countries, they're looking at saying, okay, but how can we do it more comfortably, less expensive? How can we overall get healthcare costs down? One fellow described it, healthcare, really right on the nose. To me, it was the perfect definition. It is the delay of onset of disease is healthcare.
I'm honored to have been able to talk to you today. Thank you for joining us.
That was my pleasure. Thank you.